some other people will join us as we go. I didn't want this to be a very long call, but I wanted it to be a very interactive section. And today we want to talk about clinical audit and critical appraisal in Africa, opportunities and career growth pathway. Again, my name is Chukwumezie Okolo, and I represent Right Place. And this session today is coming to us from Right Place Institute for Leadership and Strategy, the leadership arm of Right Place Synergy. And we will be talking about mainly about clinical audit and then critical appraisal, and see how those play critical roles in healthcare. So, by way of introduction, I'll be looking at clinical audits, critical appraisals, the relationship between the two, and then I'll be zeroing it down on Africa, looking at the challenges, the opportunities, and then we'll be looking at what we offer from Right Place in line with those. And then, of course, there'll be opportunity for questions and answers for us to drive home the points. A few key points before I get started. Clinical audit and critical appraisal skills are in very high demand within the healthcare space. And these skills can lead to new jobs. They can lead to new consultancy gigs. They can even guarantee better pay in certain settings. They are not just theory. These are skills that one can learn and start applying to earn very quickly. And I'm speaking from experience, because as a clinical auditor for the NHS, I covered the Berkshire East and Berkshire West for almost 2 years. And so I'm talking about what I have done and what I know very much about. It's not just theory, it's from practical experience. So clinical audit and critical appraisal are very, very important aspects as far as healthcare quality is concerned. And everybody who wants to really deliver on quality needs to have some of these skills. I also consider them hidden career accelerators within the healthcare space. It is recorded that critical appraisal could help you make make you 3 times more valuable in your team as a researcher, as a project manager, as a consultant. With these kind of skills, you don't really need all the years to start making a difference, both in your output and the quality of your work, and even also in your earning potential. You can actually start implementing them immediately. And you don't have to be a statistician or a computer scientist or a guru of some kind to be able to do these kind of things. Regardless of your background within the healthcare space, or even for some people who are trying to get into the healthcare space, these are some of the skills that you can start acquiring real quick. Now, when we look at the African health system, I can say that we desperately need people who can combine this knowledge within the healthcare space to give us the results that we so desperately need. Now, I'm going to dwell a little bit on what I would call definitions comparison in a way that we'll understand the dynamics of the discourse we're trying to have. Ideally, we should have these two topics separately and discuss them as independent ones. But I wanted us to discuss them together because of the relatedness and the value that both of them bring to the table. Because I believe that if one has these two skills, or have the skills needed to be able to do this, they will be more effective and more efficient, both in their decision making and in the implementation in practice. So clinical audit, by way of its definition, will be seen as more like a quality improvement process. It's a quality improvement process. And it checks if we're delivering health care according to pre-agreed or preset standards. So basically, in clinical audits, what we are trying to do is to check that what we are doing is what we said we're going to do, or that what we are doing is what we are supposed to be doing according to protocol, according to the guidelines or the policies. So by definition, that will suffice for now, but we'll come back to it. Please, if your phone is making noise, you could mute your microphone until you want to ask a question. Just mute your microphone so you don't. Thank you. So, by way of its purpose, we can look at clinical audits as intending to improve patient care and our service delivery by measuring our actual practice. So, in clinical audit, we are looking at our actual practice and measuring how well we are doing. So the purpose is to improve patient care, to improve our service delivery. It could be to have better outcomes ultimately. And in doing clinical audits, we focus on current clinical practice. It could be within your pharmacy, your physical therapy business. It could be just the CNAs, for example, in a home health service. It could be the oncology doctor in a rural hospital. It doesn't matter what your practice is. It doesn't matter what your specialty is. There are protocols and guidelines that guide what you do. So clinical audit looks at what you are doing versus what you're supposed to do. So the focus is always on your current practice. And the end product is on a clinical audit is to identify the gaps between what you should be doing and what you are doing. And then, of course, to drive improvement in those. So it is the interest of audit to find out if there are gaps and what are those gaps, and then how do you improve and fill those gaps, bridge those gaps. So right place, our main motto in right place is to bridge the gap. And so talking about clinical audit, it falls right within our auspice, trying to bridge the gap in practice. Again, of course, there is to carry out the clinical audit, there's always a key question. So, and the key question is simple. Are we doing what we should be doing? And that's where it starts. Are we doing what we should be doing? Because oftentimes you find out that when the results are not good, when we are having outcomes that are not desirable, when we are having increased, let's say, under 5 mortality in a particular hospital, or we are having falls in a particular setting, or we are having medication errors, or we are having misfills, all kinds of things. The first question is, what are we not doing right? Are we doing what we're supposed to be doing? So such observations should trigger an audit. Please mute your phone. Please mute your phone. Help us mute your phone. So are we doing what we should be doing is the question. And then, of course, you have to determine the tools that will be used. So in this case, you have to determine the audit criteria, the data collection tools, your audit re-audit cycle, and actually you have to understand the audit cycle and all the inputs that go into it. So who uses it? The healthcare team. It could be the hospital, it could be a clinic, it could be your pharmacy, it could be an NGO, it could be a home health setting, can use the output of an audit to improve service delivery. And then, of course, oftentimes there's always an output from that. It could be the output in terms of the report that you get, the audit report, the action plan for improving patient care, the action plan for reducing mortality or morbidity or co-infections or nosocomial infections. For improving the patient discharge times, to reduce waiting time, whatever the output is, will be reflected in that report based on the outcome of interest. Now, by this, I just looked at clinical audit. So basically, in clinical audits, what we are trying to do is to check what we are doing against what we should be doing, asking the right questions, looking for the right parameters, and then being able to measure how well we are doing and see where the gaps are. And then, of course, based on the gaps, we can then recommend what needs to happen to improve or to bridge those gaps. But then for you to be able to recommend what needs to happen to bridge those gaps, some decisions have to be made. And those decisions have to be evidence-based. Can somebody please mute your phone? We are having so much background noise. We are having so much background noise. Please, can you make sure your phone is muted? So there has to be some decision made to be able to recommend what needs to happen to bridge those gaps. And this is where critical appraisal comes in. And so clinical audit and critical appraisal are brothers. And these brothers work together to improve the quality of care that we deliver. So by reason of its own definition, critical appraisal is a systematic process to assess the reliability, the validity, and the relevance of the piece of evidence before we can actually apply it or implement it in our practice. And so the purpose of the appraisal is always to evaluate the evidence and decide its trustworthiness and the applicable or its applicability to patient care within our setting. So certain decisions have to be made, and certain skills are needed to be able to reach those kind of decisions. So its focus is basically traditionally on published research studies, traditionally. But in certain cases also, we see where the focus may not really be entirely on published evidence. It could be published research studies that also may have been implemented elsewhere based on the evidence. But then somebody will have to also critically review that evidence upon which these other people have made changes in their own, to see that it is applicable within your own space before you can actually implement. And this is important. So the end product on a critical appraisal is about the deciding whether this research should influence our clinical decisions, whether this piece of evidence should influence what we do now, whether it should influence any changes or help us to achieve the bridge in the gap that we have noticed from the audit. And the key question is in critical appraisal is always, can we trust the study? Or should we apply its findings? So to make that decision, to answer these questions, can we trust a study? A lot of things have to come into it. You have to look at that study and dissect its setting. What kind of research design? What is the sample size? Where was it conducted? Who conducted it? How did they analyze the data? How did they reach the conclusion that they reached? What questions were they trying to address? Did the research question address the issues that are of importance? So there are a lot of decisions go into that decision about whether you can trust this study. And then, of course, you're talking about where was it done? So now, is it something that you can actually directly apply within your own setting? And if not, why not? So these are some of the skills that will make your critical appraisal of high value. Now, apart from the research question, there are a few tools that have to be used. So there are a few critical appraisal tools that we know and that we also teach at Right Place. And we'll get into other details in the how. So who uses this critical appraisal? Clinicians, researchers, policymakers, students, public health workers. So people who have to make decisions, who have to use data, who have to use research, who have to base their decision on evidence from research, have to be able to do critical appraisal. Even a PhD student should be able to critically appraise a piece of evidence to see how it applies in his work. To be able to, when you are doing, like, let's just say, for example, you are doing systematic reviews, you have to be able to appraise a piece of evidence to make sure that it qualifies for inclusion. Otherwise, you will include results that will contort the whole picture of what you're doing. So the output in that will be a decision to adopt or to reject this new treatment or this piece of evidence based on the quality that you can attach or attribute to that study. And this is very important. So if we understand clinical audit and the place of critical appraisal and how those two play together, then it will be easier for us to make progress within the healthcare space. Again, let's recap quickly. In audit, we check our healthcare practice to make sure we are doing what we promise to our patients. In appraisal, we check other people's research to make sure it is trustworthy before we can use it to change our own practice. I hope we get that. Now, in Africa, we need the two. We must fix what is wrong with our system, but we must be smart about it, and we must look at what research we can trust. We have to assess the research before we can trust it. We're not going to say, oh, this was done in America, therefore it is good. Oh, they have done this, adopted it in the UK, therefore it's acceptable. No, we have to look at other factors that come to play before we make those kind of decisions. So clinical audit will improve care, will improve help with our internal healthcare practice, and will help us to improve our processes. Critical appraisal will help us to evaluate evidence. We help with external published studies and in evidence-based decision making. Now let's narrow it down to Africa. And we know that in Africa we have actually made great progress in healthcare, but we still have major challenges. A lot of preventable deaths are still common, too common actually. We have wasted resources and poor quality services still, harming our communities. Lack of accountability often destroys the public trust of the health system. But beyond these failing systems, there is also the opportunity for change. And that change starts when we begin to measure what we are doing and act on what we find, which is what clinical audit avails us the opportunity to do. It avails us the opportunity to measure what we are doing and to act on what we find. If we cannot measure what we are doing, then how can we improve on it? So our continent is facing high preventable mortality, morbidity, medical errors, misfeels. We are suffering from weak health data systems, undertrained staff, fragmented service delivery, donor and regulatory pressure to improve quality. We have gone beyond access now, we're talking about quality. So beyond access, quality is where we are now. Without quality, I don't know if anybody needs that service, that access. So yet, clinical audits are still very low cost. They are adaptable. They are practicable. And they could actually bridge the gap between care standards and actual practice. But we have to remove the barriers. And that's part of what we are trying to sensitize us to do. Is we can remove, once we remove the barriers, we'll be able to start addressing some of these issues. So why audit? It is a very effective, even though oftentimes it's neglected, but a beautiful tool for improvement of quality within the healthcare space. Audit tells us, again, are we following the right standards? Very important. We must answer that question every time we do audit. The question is, are we following the right standards? So we could question our practice. We could also question the standard that we're using to practice. Now, if the standard is good, then are we doing what we're supposed to be doing. Now, when we don't have the outcome that we desire, it's possible that the standard by which we are practicing is not delivering the result. And so before we can even change those standards, we have to go back to do critical appraisal of literature to be able to change standards. So that audit also shows us where exactly we are falling short. It is by the tool of clinical audit that we can find where we are falling short. That means, where are the gaps? And then, of course, it also gives us a clear path on how we can fix it. So it shows us, tells us what we are doing. Are we following the right standards? It shows us what exactly we are doing, where we are short. And then, of course, it gives us the clear path to fix it. And this is the reason why we believe that clinical audit should be a regular tool within healthcare, that every system, every clinic, every hospital, every healthcare delivery establishment should have people that have the skills and the competencies to carry out audits from periodically. In many countries, it has become the real engine. Like I was saying, back in the day in the UK, all I did for the NHS was clinical audits. There's nothing I didn't audit. If there was suicide recorded in the PCT, we went to audit why did suicide happen. If there was misfills in the pharmacies, we went and we did audit in the pharmacies. The doctors have some issues, so we go back, we look at the protocols, we audit them. So these are regular quality assurance and quality improvement strategies. And in Africa, we tend to play with some of these things. We still have huge gaps here. And that means that we are also, with these huge gaps, mean huge opportunities for people who know how and who can bridge those gaps. And I think that's why we are here, to open our eyes to the possibilities and the opportunities that these skills will provide us. So I have a question for you. Have you ever been involved in any form of audit or clinical audit within your facility as a healthcare provider? Even in your business, when things don't go right, or things keep going wrong, or things you're not hitting target, audit is called for. So, have you ever been involved in any form of clinical audit? Yes, no, you don't know? Again, just answer to yourself. If you have opportunity to type, you can type for me. But for us also, it is important for us to know, even if you have not been involved in it, that's why you're here. And so I will have to answer, why is clinical audit important? Why does it matter in Africa? One, Africa is considered a low to medium income country. So I would say most of us are resource poor countries. And so because we face resource constraints, and but we also have poor outcomes from our healthcare, and we have fragmented system. People like to work in silos around here. So clinical audit will now provide us a low-cost but high-impact solution for continuous quality improvement in healthcare delivery. Without audits, what is going to happen is that we waste the limited resources that we have, and we miss a lot of opportunities to save lives. There are a lot of casual deaths from our hospitals. A lot of people go to the hospitals walk into the hospitals and they are carried out of the hospital as corpses. And you wonder why. A lot of people are doing well today. The next morning they call it, they say the person died. And of course, nobody questions anybody here. And because anytime somebody dies or something, we say, well, God gave, God has taken. May the name of the Lord be praised. And everybody goes on. And so people don't understand the need for quality improvement and the need for quality assurance within the healthcare system. Overseas, you don't get away with certain things. And so time has come for us to be able to incorporate clinical audits and clinical effectiveness and critical appraisals within practice to ensure that we improve on the quality of the delivery of our services. The reality is this, that in many of our countries, limited funding, staff shortages, fragmented systems create daily struggles for healthcare delivery. Of course, I was talking to somebody the other day and she said something about people not going to the hospital. And this lady said, well, the problem is that all the doctors that she knows have left the country. What we have are all native doctors. So we all know that the healthcare personnel is very much, we are very much in shortage around here. I was looking at the statistics on how many doctors per patient that WHO recommends, how many pharmacists per patient, how many dentists per patient. All of these specialties, we are way behind the projected numbers. And so we can understand that because we don't have enough, then there is so much pressure on the few people that are working. When 5 people are doing the job of 10 people, or when people are working below the level of their competencies, so you can understand that the health outcomes are going to be not desirable. But if we now build in support from clinical audits and support from critical appraisal, then we'll be able to make even better decisions and make sure that we are following processes and protocols within the system to at least improve the outcome that we get. So clinical audit will offer us powerful ways to work smarter and do what we have to, identifying small changes that can save lives without really needing a massive investment in new resources. And this is key because we need to innovate to be able to help give the results. By all means, we want to make sure that at any point in time we have done the best we can to save lives and to improve the outcome that we get without making a lot of excuses. But we have a lot of barriers, and I'm probably going to just talk about 3 of them. Barriers in carrying out clinical audits. A lot of things don't get documented in our hospitals. And of course, in audit, if it is not documented, it didn't happen. So some of it are deliberately not documented. So you don't know what happened. Some of it, maybe it was just from missing or incomplete data, or just from incompetence. People have inaccurate records. And so it is important that personnel working within the healthcare system receive some kind of training in audit and to be able to, guarantee proper documentation. That is key. There is also some kind of resistance to change. Maybe we can call it culture change. People have done the bad thing for so long that it has become culture. And so anything that will change that, they resist. So the staff may see audit as someone trying to witch hunt them, or someone trying to fire them, instead of looking at it as a tool for improvement. There could be fear, and they could become defensive instead of being honest in their assessments of what they're doing. So this can be a big barrier. Of course, again, audit is always data-driven. It's data-driven. So many facilities lack reliable electronic system or some kind of standardized data collection methods to be able to collect meaningful data that you can use. Now, manual audits can be a little harder and a little slower, and often also less reliable, because the quality of such data may be in doubt. So in Africa, basically, these can be three major barriers to clinical audit. The documentation, when it is poor, or when there is no record, no evidence, then there can be no audits. The cultural resistance, like I said. So when staff is seeing it as being punished instead of learning, or when staff fear that they could be punished instead of embracing audit as an opportunity to learn and to grow. And then, of course, I talked about the weak data system. So good decisions need good data, and that's often missing in Africa. Now, overcoming these barriers will unlock huge improvements and create opportunities. What are those opportunities? There are quite a number of opportunities that clinical audit will provide us with. We're talking about universal health coverage. Universal health coverage is a possibility, but it's not just about access, it's about quality of care. And so clinical audit will help us to achieve that universal coverage where quality is also not left out of access. Demonstrating donor accountability. So donors are increasingly demanding measurable quality assurance before they release funds to maybe some non-profit healthcare delivery systems, or healthcare delivery systems that receive funding from some of these donors. So for you to be able to demonstrate credibility, show results, show that you qualify for further funding, or even for the funding you are requesting, then you need the tools of clinical audits to demonstrate that. Now, there is also a need for building national quality frameworks, what you call national quality frameworks. Certain countries in Africa are already beginning to implement those. Ethiopia and Ghana stand out. Even Kenya also are doing some work in embedding clinical audits into their national health strategies. And Nigeria should be able to lead in those kind of operations. So the future of healthcare in Africa has to be built on quality as much as on quantity. So as much as we are trying to make sure that everybody can have access to healthcare, which is quantity, and I get that, quality should be important. Otherwise, what tends to happen is in places where quality is not deliberately put on the table, it gets relegated. And we have also noticed that healthcare for the poor always tends to be poor healthcare. And that ought not to be so. So universal health coverage requires that we carry everybody along quantity, and at the same time that quality is assured. And that's what one of the things that clinical audits can help us achieve. So if we must achieve universal health coverage, then securing vital donor funding or building strong national health systems, then we must understand and incorporate clinical audits. My question will be, quite a few of them I want to ask. In implementing audits in Africa, what would a clinical audit look like in a typical facility, either in your hospital, your clinic, your organization? What are the biggest day-to-day barriers that you may encounter in trying to carry out clinical audits? Are there small wins or success stories that you may have had or that you can share? How about paper-based stroke digital audits? If you have done anything audits before, how realistic is digital data collection for audits in most African settings? Do you think there's a problem with that? What are the advantages and the risk of moving from paper to digital audits? How can digital innovation help us to leapfrog what we would call traditional barriers? Okay, so what about getting buy-in, staff buy-in, leadership, training? How do you convince frontline healthcare workers that audits are for improvement, not for punishment? And what role do you think the leadership will play in successful audits, both in carrying out, in planning the audit, in executing the audit, or in implementing the recommendations of the audit? Now, what kind of training and support have made a difference in your own experience, if you have had any experience? Okay, so how about aligning the audit with accreditation or funding, for example? How can facilities use audit results to meet accreditation standards? And how important do you think clinical audit could be for maybe something like the NGOs or for donors to assess grant proposals or some ongoing funding applications? What advice would you give facilities or governments trying to integrate audits into their national quality strategies? So some of these questions are the questions that we can help you answer here at Right Place. So I'm trying to recap on the clinical audit part. So remember that while the barriers are real, from weak documentation to staff resistance, so are the opportunities in clinical audit. So the audits are not about catching people. They are about catching problems before they catch us. So when we are doing audit, it's not about who did this or using it as an opportunity to terminate somebody's career. No. If anything, it will be an opportunity to determine areas of training and to teach and train, and to improve quality. And that is why those are some of the skills that you could get from learning or getting involved in clinical audits. A lot of people who are looking for jobs could develop these skills. It doesn't matter what their background is, and they could make a lot of career, a very good career doing this. I was a pharmacist, but I was doing clinical audits, and I was auditing all kinds of people within the healthcare space. So we have the knowledge, we have the tools, but there is a need for leadership and training, and a little smart innovation. And with that, we can make clinical audits a permanent engine for healthcare improvement across Africa. And this is the vision. This is the goal. We must get to the point where clinical audit is integrated into the practice so that it doesn't matter whether it is a rural hospital in Obuk or in a big hospital in Abuja. The purpose is the same, to make sure that patients that walk into the hospital get the best available care within the space, that people get what they have paid for or what they expect from the hospital or from the healthcare facility. It doesn't matter whether it is a pharmacy, that the pharmacist delivers the best quality care to this patient, and the product, whatever it is that they need to be able to get better. Because the beneficiary of the skills that you have, or that the next person has, or that healthcare provider has, or that healthcare system can provide, could be you or your one. It could be your loved one that you don't know. So there is a big role that leadership can play to make clinical audits a permanent engine for healthcare improvement across Africa. And this is what we are going to be pushing for. So my question again to you will be, which of these will be the biggest barrier to audit in your facility? Poor documentation, or no leadership support, no funding, or staff resistance? I have a few case studies that I could have gone into, but I don't think I have enough time to go into case studies. So I'm probably going to skip the case studies, but I will summarize them. A case study could be a case study to improve maternal mortality within a rural hospital. So because maternal mortality is being underreported, some of the paper records don't even have all the details. So you can't even track them because they are not recorded. So an audit was designed to investigate this, and eventually it introduced structured maternal death audits, some audit forms within the system that they check every so often. And this audit was able to result in 30% improvement in documentation quality. And it also identified common avoidable factors that lead to maternal mortality. It also led to targeted changes in some of their operations. And the lesson they learned is that leadership, commitment, and non-blame culture are key to improving maternal mortality. And the take-home from that was better documentation, better learning, better maternal outcomes. And this is one of the reasons that audit is the way to go. Another case study was about infection control. So they found out that there is a frequent outbreak of healthcare-associated infections. The audit was about the audit process was more like a manual audit of hand washing, waste disposal, cleaning protocols, and all that stuff. And the result was that hand hygiene compliance rose from 20% to 75% in 6 months. Significant drop in surgical site infections was recorded. The lesson learned was that even simple manual audits can drive big behavioral change when frontline workers are empowered. Take away small data, big impact. Another case study of a real-time digital auditing. The outpatient flow was chaotic in a hospital, in an urban hospital. There was long waiting times. I have also done some works in this long waiting times at the emergency room in the United States, in Mecklenburg County in North Carolina. So, but this one was somewhere in Africa here. The audit process deployed a mobile app for real-time tracking of patient flow and bottlenecks. It resulted in reduced waiting time by 40% in 3 months. Staff more engaged because data was visual, live, and transparent. And the lesson learned was that technology makes audit easier, faster, and more motivating if adapted to local realities. And the key takeaway was digital tools amplify quality, but they must be simple, they must be friendly, and frontline driven. So these are just to show some of the case studies where audit has been used to be able to change outcomes and drive improvement in service delivery. So let's reflect for a minute here. The stories that I just recapped, those 3 stories are not just technical exercises. They were life-saving, system-changing acts of leadership. Whether we're using paper forms in a rural clinic or mobile apps in an urban hospital, audits turn problems into progress. Audits turn problems into progress. So imagine the change we could create across Africa if we scale up these efforts. So what is that one idea that these case studies, from these case studies that you could try in your own facility or in your own local hospital or local health care facility or local primary health care unit? So the skills for audit are very important, and they will help you to design effective clinical audit, help you to employ digital tools for audits, especially the ones that could work within your system, or to build a culture of accountability. So there is a need for us to train the next generation of clinical auditors around Africa, and this is important. Now let me talk about critical appraisal real quick before I wrap it up, and then I will open up the floor for questioning very soon. Remember, in this introductory presentation, our plan is to talk about the why, the what, and the what we're talking about today is clinical audit and critical appraisal. And then we're talking about the why. Why do we need it? And so the how we're not able to address today. Now, critical appraisal, like I said, is a process, remember, of carefully and systematically examining the research evidence or guidelines or reports or data to judge their trustworthiness and their relevance and their applicability in a particular setting or in a particular context or your own healthcare space. So key elements of that is validity. How accurate and reliable is the evidence? And you have to be able to make that decision. How big and meaningful are the results? Is it relevant to my patient, my hospital, my community, my locality, my cultural realities? Now, critical appraisal will help us to avoid being fooled by bad research or biased reports. It teaches us to ask, can I trust the evidence? Will it work for my people here, now? Many African countries face all this flood of guidelines and new policies and donor-driven programs. But without critical appraisal, weak and irrelevant evidence could get implemented, and that will also go ahead to even waste further resources for us. So why Africa must master critical appraisal? 1, resource protection. 2, context sensitivity decisions. And 3, empowered healthcare workers. Our resources are already scarce, so we don't want to waste any more. The global evidence that we have access to must be localized. Otherwise, we will be imposing on ourselves what is not relevant to us. So anytime that we want to implement an evidence, we have to question that evidence. We have to weigh that evidence within our own realities, our own resource system, our disease system, our health system, our cultural setting. Very important. So in Africa, every dollar, every vaccine, every antibiotic is important. So critical appraisal will help us to protect our communities by ensuring that what we do is both right and smart. When we appraise poorly, again, of course, it will lead to inappropriate use of resources. We see in some hospitals, they buy equipment that they don't need. Or in some healthcare system, they buy equipment that they don't need. Or in some government hospitals, you go there, you find a lot of machines. Or even in some research institutions, they buy machines that they don't even know how to use. Because somebody wants to make money into his own pocket. He goes and buys some machine and dumps it. Nobody even some of them have machines that are written with instructions in a language they can't even interpret. We see also in some hospitals, we see like people buy useless drugs that sit on the shelf. Maybe they buy brand names instead of getting generic equipment that can work, and they waste money. And yet patients don't get treated. We see people spend money on irrelevant campaigns, and when you look at the budget that they have wasted, they're wasting resources. So poor appraisal could lead to some of those, where people are just trying to become copycats, import something that is being done somewhere and dump on their own system without critically appraising those. So when we don't critically appraise, we lose money, we lose trust, and more importantly, we lose lives. And we are not supposed to be losing life. We're supposed to be saving lives. Now, wasting money in a rich country could be bad. Wasting money in a poor country is deadly. So finally, I want us to remember that what clinical audit does is it tells us what is happening. What is happening, as in what are we doing, and how does it compare to what we should be doing. But critical appraisal tells us what should be happening. So while clinical audit is talking about what is happening, critical appraisal is about what should be happening. But together, they form the engine of safe, of smart, and of sustainable health care. Now, finally, how do we come in here? In Right Place, we have a 6 weeks course, a 6 weeks certificate course that will teach you clinical audits and critical appraisals in real practical terms. We have the expertise and we have the staff strength to carry on this 6 weeks intensive cohort-based study, and that is one of the many courses that we offer on clinical audits and critical appraisal. So what do you get at the end of the 6 weeks? You understand and you can articulate audit cycle. You can plan, you can design, you can report, you can execute a clinical audit. You will know how to integrate audit into quality improvement programs. You should be able to not just learn, but be able to lead a team and to be able to teach your team or even train your team on carrying out audits. And you should be able to carry out some audit project within those 6 weeks. What else do you get? You also be able to do within those 6 weeks, get hands-on training on the tools that you need for critical appraisals of evidence. And you should be able to implement critical appraisal in decision making within the healthcare space. And like I said, we have the facilities, we have the expertise, we have the team able to help you do this. And there are a lot of roles that you can explore or pursue with these skills within the healthcare. And you can even just carry out a simple Google search on what kind of jobs or job opportunities are available for me if I have clinical audits and critical appraisal skills, quality assurance, hospital auditors, health project evaluators, grant proposal writing, clinical research associates, healthcare consultants, training and facilitation. I mean, freelance consulting. I mean, the list is endless within the healthcare space. And so I'll let you look at those for yourself and see. But more than anything, you can always reach out to us and we can always talk about how you can be part of the trainings that we have and what you stand to gain. At Right Place Institute for Leadership and Strategy, we welcome you to check us out and see some of the courses that we have offering, but clinical audits and critical appraisal is one of those. It's a 6 weeks intensive course. We have a 1 day of the week. We have about 2 hours of class, and then there will be assignments for the week, and then there's a platform where you can post your questions. You can get mentorship and guidance throughout the whole week, and then until the following week again, 1 day a week by Zoom like this, or by virtual meeting. We connect for about 2 hours or 2 to 3 hours depending, and then have interactions. We give you the assignments. We guide you again for the week. You do some work. You submit your assignment. It takes a whole 6 weeks, and then you have a capstone project, and you are certified. And from there, we can help you develop your resumes and help you identify some jobs that you can even explore if you want to. So these are some of the things that I want to make available to you today, and I'll be happy to take questions or comments or whatever. Thank you very much. Any questions for me? Any questions for me? I was happy, if anybody wants to get the slides, I'll be happy to share them. If you request, I'll send them to you. Otherwise, if you have my number, you can always send me a text or reach out to me if you have any questions. Or if you know anybody who could benefit or who want to be part of this, please feel free to send them our way. Unless there's any question, I can say thank you very much for joining us. It's our pleasure to have you this evening. And my name is Mezia, Right Place.